Hello, this is part 2 in Psychological Consultancy for Family by Psycho Forward Romania. Well, in dealing with family includes educating, counseling, and teaching coping techniques to families affected by various psychiatric issues. There are several therapies available for various diseases such as depression, psychosis, child and adolescent issues, and alcohol use disorders. Such families will require psychoeducation regarding the disease in issue, as well as advice on how to deal with the index person who has the psychiatric disorder, giving basic knowledge on the illness, its courses, causes and treatment, and prognosis is part of psychoeducation. Depending on the time available with clients and their families, these basic information sessions might run from 2 to 6 sessions. Quick fixes may include dealing with parent-adolescent conflict at home, which require brief counseling to both parties about their respective expectations and enabling direct and open communication. Further family treatments may address issues such as future goals, employment prospects, pharmaceutical supervision, marriage and pregnancy in women, behavioral control, increasing communication, and so on. It is an excellent therapy strategy for assisting family members in adjusting to an immediate family member suffering from an addiction, a medical condition, or a mental health diagnosis. Family therapists, in particular, are relational therapists. They are more often concerned in what happens between persons rather than within one or more individuals. Depending on the conflict at hand and the stage of the therapy, a therapist may concentrate on analyzing specific previous instances of conflict, such as reviewing a past incident and suggesting um, alternative ways family members may have responded to one another during it, or instead proceed directly to addressing the sources of conflict at a more abstract level, such as pointing out patterns of interactions that the family might not have noticed. Typical aims of family therapy are enhancing the communication, managing family problems, understanding and resolving particular family conditions, and establishing a better functional home environment. Moreover, it includes investigating family interaction patterns and their relevance to psychopathology, using the family internal resources and functional resources, repairing the dysfunctional interactional family types, improving the family problem solving abilities. The typical cause for referral are starting following, yet it is possible for the causes found initially are merely a tip of many more latent problems within the family that will be discovered later during further exams, such as problems in marriage, parent-child conflict, sibling rivalry, the impact of disease on the family members' adjustment concerns, parenting abilities that are inconsistent, psychoeducation for family members regarding an index patient's disease. During a session, even the most experienced psychologist can face difficulties. Here are some important tips addressed to the psychologist in order to achieve success and to preserve one's health. In order to help others, help and attention should be placed upon the practitioner as he or she is offering its best services. Establishing good communication skills. While a psychologist must be able to communicate successfully with their clients, co-workers, and the other professionals. This involves the ability to actively listen, ask open-ended questions, and offer clear and simple feedback. Empathy is the capacity to comprehend and share the sentiments of another person. As a psychologist, one must be able to sympathize with clients and provide a secure and supportive atmosphere for them. This is highly appreciated quality nowadays. Keep current with research. Psychology is a fast growing subject. It is critical to stay current with the newest research and advance. It involves attending conferences, reading articles, and taking continuing educational classes. Education never stops, and learning every day can offer new ways to practice and open new doors. To preserve the ethical standards, a psychologist must uphold high ethical standards, respecting the client confidentiality, avoiding conflicts of interest, and adhering to professional norms of behavior are all part of this. Developing a specialization, a psychologist might benefit by specializing in a certain field of psychology, such as clinical psychology, neuropsychology, or forensic psychology. This enables to gain significant experience in a certain subject and give specialized services to the client. Collaborative with Collaboration with other professionals. Well, psychology frequently necessitates collaboration with other professions, such as physicians, social workers, or even educators. It is critical to establish solid working connections with these specialists and to communicate effectively with them. Last but not least, to cultivate self care practices. Providing psychological services can be emotionally draining, and it is important to prioritize self care practices such as exercise, mindfulness, and adequate rest. This ensures being able to provide high quality services to clients while maintaining health and well being. Another list of issues it is often recurrent in family therapy sessions. Therefore, therapists should pay attention to have complete control over the session. Other individuals or even family members may be authoritative and take charges at times. In crisis situations, when the family is unable to work as a unit, the therapist should take charge of session and establish a specific condition that, in his professional opinion, it enhances the odds of success. Over involvement with the family is a typical concern for new therapists. When he realizes this, he may panic and retreat, becoming distant. Rather, before attempting to create a rapport, one should softly attempt to participate in with the family, earning their actual respect and confidence, and maintain his patience. Many families assume that the problem is caused by one index patient, which may appear to be a tactical blunt at first. As a result, it might be essential to agree with the family's theory that the problem is caused by this individual. It is best to educate the family from the start that the problem might be with the family, particularly when recommendations for family treatment involving numerous members are made rather than with one individual. Cultural sensitivity. Family therapy may involve clients from diverse cultural backgrounds. It is important to be aware of and sensitive these cultural differences are. This includes understanding how culture can impact communication styles, beliefs, and values. To summarize, becoming a competent psychologist necessitates a wide range of abilities and considerations: strong communication skills, empathy, remaining current with research, upholding ethical standards, establishing specialty, partnering with other professions, and empathizing. Self care routines are just some of the examples. Certain difficulties in family therapies should be recognized and handled as appropriate, such as confidentiality, power relations, cultural sensitivity and emotional intensity, diverse views, boundaries, and structural issues. Psychologists may deliver successful and meaningful services to their clients by keeping these criteria in mind and always trying to enhance their abilities and expertise. Thank you for listening.